Have you quietly given up on something that you love because of pain that just won't go away? Maybe your heel screams every morning when you get out of bed. Maybe your elbow lights up when you lift groceries or swing that golf club. Maybe your shoulder hurts so much you can't even wash your hair or put your dishes away. If that's you, I want you to know something very important. You are not doomed, and surgery is not your only option. My name is Marli, and I'm a physiotherapist here in Kitchener-Waterloo. And in this video, I'm going to show you a treatment called Shockwave Therapy that has completely changed my life and the lives of many of my patients. And at the end, I'll show you how to book your first assessment and shockwave treatment. If you've been in pain for months or even years, stay with me for a few minutes. This might be the turning point. Let me ask you a few questions. Do you have elbow pain that makes it hard to open jars, open your car door, carry groceries, or play sports like golf or tennis? Or do you have foot or heel pain that is brutal in the morning when you first stand up? Every step at work, torture. If you're a hairdresser, a server, or just on your feet all day, or forces you to only wear special shoes so you can make it through your day. Or do you have shoulder pain that stops you from lifting your arm overhead, makes it hard to shower, wash your hair, or put your hair up in a ponytail? Maybe you can't reach that top cupboard anymore, or play your favorite sport, or go to the gym. Or do you have constant numbness or tingling in your hands, like carpal tunnel, that makes sleeping, working, or using your phone absolutely miserable? If any of that sounds like you already know this. It usually doesn't just go away. In fact, when we keep using those painful joints and tendons day after day, it often gets worse. Most people that I see have already tried resting it. They've tried the brace, the ice, sometimes even traditional physio. Maybe you've been told, well, if it gets bad enough, we can always do surgery. And in your head, you're thinking, I guess this is just my life now. I'll always be in pain. If that's you, I want you to really hear this. There's a non-surgical, science-based treatment that has helped a lot of people with chronic pain get back to walking, working, golfing, hiking, and playing with their grandkids again. It's called Shockwave Therapy, and I specialize in it. So what exactly is Shockwave Therapy? In simple terms, Shockwave Therapy uses acoustic sound waves that travel through the tissues, using a gel as the conductor. Those waves stimulate your body to heal itself. We're not masking your pain. We're not just numbing the area. We are sending a strong signal to your body that says, hey, something here needs fixing. That signal increases blood flow and brings your natural healer cells to the area so that you can actually repair the damaged tissues. It's the same kind of technology that professional sports teams have used for years to help athletes recover from injuries faster. The difference is you don't have to be a pro athlete to access this anymore. Here in Kitchener-Waterloo, I'm one of the only few clinics that offers it. And this is not something I just do for my patients. Shockwave Therapy saved my own career. I had severe carpal tunnel pain for almost 3 years. As a physiotherapist, I use my hands all day. Ironically, helping other people with their pain ended up causing debilitating pain in mine. It got to the point where it looked like surgery might be my only option. I thought, what do I do? What if I can't keep doing the job I love? Then I tried Shockwave. Because my injury was very chronic, I needed several rounds, but I kept at it. After about 3 rounds, that's 12 treatments spread over several months, I was able to use my hands, pain-free again. Still working, still helping people. So when I say this treatment can be life-changing, I am not exaggerating. I have lived it. And it's not just me. One of my patients is a nurse and an avid hiker. She had terrible Achilles tendonitis and plantar fasciitis. She had to take time off work. She had to stop hiking the Bruce Trail with her husband. She honestly thought she'd be in pain forever. That's 3 months total. Now she's back to full-time nursing. She finished the entire Bruce Trail with her husband, and she's enjoying her life as a grandma without that constant pain. Another patient, a gentleman with tendonitis in both elbows, tried everything. Braces, rest, all the usual. He missed a full year of golf with his friends because of his pain. After 2 rounds of Shockwave, he was back on the course. He played around 50 rounds of golf this summer with his friends and got his favorite hobby back. And for some people, it's even faster. I've had patients with plantar fasciitis who did just 2 treatments and didn't need any more. I've also seen a shoulder that was painful for 2 years respond after 1 single session with no more treatment needed after that. Of course, everyone is different, and I can't promise exact results like that for you, but these are real outcomes I see in my clinic. So, how does the process actually work? Typically, we talk about Shockwave in rounds. 4 weekly treatments, then 1 month off. During that month, even though you're not getting Shockwave, your body is still healing from the stimulation we gave it. That's why a lot of people notice their biggest improvements during or right after that rest month. Depending on how long you've had the injury or how severe it is, some people feel significantly better after 1 round. Others do 2 rounds. More stubborn chronic cases might need 3. But here's something important. You're not locked into a big expensive package. At my clinic, you pay per session, 1 at a time. Your first visit is always a full physiotherapy assessment, plus your first Shockwave treatment for just $15 more than a regular physio assessment. After that, if Shockwave is right for you and you choose to continue, you simply book each treatment as you go. If you get better faster than expected, great. We stop. I'm not going to keep you coming just because. If you don't need the full 4 sessions in a round, we simply don't book them. You only pay for what you actually receive. And if you come in and I assess that Shockwave isn't appropriate or won't help your condition, we don't do the Shockwave. In that case, we're paying just for the standard physio assessment. And I'll either recommend other treatments like ultrasound, laser, or acupuncture, or send you to the right specialist. Either way, you leave with a clear next step, not more confusion. On the payment side, you pay at the clinic, before or after your session. If you have benefits, our front desk can usually do direct billing for you. If you don't have benefits, you can pay with the card you have on file. We make it as simple and stress-free as possible. After you book, you'll arrive at the clinic and check in at the front desk. They'll ask if you're new to the clinic and check that all your information is correct in the system. We'll get your consent forms sorted out. We take our shoes off at the front, and you're welcome to help yourself to some tea while you wait. I'll come out to get you, bring you to my treatment room, and we'll sit down and talk through your pain, your history, what you've tried so far, and what your goals are. Then I'll assess the injury to make sure Shockwave is safe and appropriate for you. If it is, we do your first Shockwave treatment right there in the same appointment. You don't need to book something separate. You'll leave that first visit with a clear understanding of what's going on, a plan for how many treatments we're aiming for, and specific instructions on what to do between the sessions. By now, you might be thinking, how do I start? It's very simple. If you're watching on this webpage, click the button below this video that says something like book your Shockwave assessment. On the booking page, choose Shockwave Physiotherapy Assessment. To keep it simple, just choose that one. You'll see my calendar. Pick a day and time that works for you. You could book ahead into the future if you need to. Then just click continue and follow the prompts to create a quick account if you don't already have one. That's it. You've got your first appointment booked. Please only book 1 appointment to start. We'll plan any follow-ups after I've assessed you. If you're not comfortable booking online or you're not as tech savvy as you wish, that's okay too. You can call the clinic directly. Therapy. The phone number's right below this video, and our front desk will happily book your appointment for you and help you with any forms. Shockwave Therapy might be a great fit for you if you have chronic tendon or joint pain, like tennis or golfer's elbow, plantar fasciitis, Achilles tendonitis, rotator cuff or shoulder issues, gluteal tendonitis, or carpal tunnel symptoms. You've already tried rest, braces, maybe even regular physio, and you're still in pain. You want to avoid surgery if possible, and you're ready to try a non-invasive treatment that helps your body heal itself. It's not a magic wand. It's not for every single condition. That's why I always start with an assessment to make sure we're doing the right thing for your specific body. One last thing. These types of injuries rarely get better when we just ignore them and push through. The longer you wait, the more your body adapts around the pain and the harder it can be to fix. The best time to book your treatment was yesterday. The second best time is today. If you're tired of waking up and dreading that first painful step, avoiding the activities you love, or feeling like surgery is the only thing left, then take the next small step. Click the button below, book your Shockwave Physiotherapy assessment, and let's see if this life-changing treatment is right for you. I would love to help you get back to walking without thinking about every step, or playing your sport, working your full shifts, and enjoying time with your family without that constant ache in the background. Thanks so much for watching. Now's a chance to start making positive change. Just click the button below to book, and I can't wait to see you at your first appointment.